Hello, in this video, I will give you some information about the drug Cardizem, whose active ingredient is Diltiazem. If the video is useful for you, please like the video and subscribe to the channel for support. What is Cardizem? Cardizem, also known as Diltiazem, is a medication belonging to the class of calcium channel blockers. It is used to correct irregular heart rhythms, treat high blood pressure, and alleviate symptoms of angina. How does Cardizem work? Cardizem works by blocking calcium channels. These channels allow calcium to enter heart cells, which is necessary for muscle contraction. By blocking these channels, Cardizem regulates heartbeats, dilates blood vessels, and reduces blood pressure. What conditions is Cardizem used for? Cardizem is used for treating conditions such as high blood pressure, angina, and certain cardiac rhythm disorders. It can also be used to prevent rhythm disorders following heart surgery. How should Cardizem be taken? You should take Cardizem as prescribed by your doctor. Typically, it is taken orally once a day or more. It can be taken with or without food, and if taken with food, it can be taken on an empty stomach. However, dosage and administration instructions should be determined by your doctor. Who should avoid using Cardizem? You should consult your doctor before using Cardizem, especially if you have conditions such as heart block, low blood pressure, liver or kidney issues, or serious heart disorders. What are the interactions of Cardizem with other drugs? Cardizem can interact with certain medications. It may have interactions with drugs that lower blood pressure, beta blockers, antiarrhythmic drugs, and others. It's important to inform your doctor about all medications you are taking. Can Cardizem be used during pregnancy and breastfeeding? The use of Cardizem during pregnancy and breastfeeding is a matter that requires careful consideration and consultation with a healthcare provider. While there is limited data available on its safety during pregnancy, it is generally not recommended for use during the first trimester due to potential risks to the developing fetus. What are the side effects of Cardizem? Common side effects of Cardizem may include headache, dizziness, fatigue, nausea, and constipation. While more serious side effects are rare, they might include irregular heartbeat, significantly low blood pressure, and allergic reactions. Immediate medical attention is advised if such effects occur. If the video was useful for you, for support, like the video and subscribe to the channel. Share your views and experiences in the comments section. I wish you healthy days.